Hello to everyone. September is Newborn Screening Awareness Month. And as the co-chair of the Bipartisan Rare Disease Congressional Caucus, I am proud to stand with the rare disease community in making sure that newborns with rare diseases are able to get accurate diagnoses and life-saving treatments. I experienced some of this when my daughter was born. She was a newborn. She had a medical condition that made her unable to swallow. And even after numerous medical tests as an attempt to identify the underlying issue, we never to this day really learned what was wrong. She was fed with a stomach tube for over a year. She had multiple ins and outs of the hospital. And so I was able to see the love of the rare disease community, people with kids that were in so much more difficult conditions than her, with babies in the NICU day after day after day. My case was so much easier. For some reason, she got better. We still actually don't really know what was wrong, but I know that feeling of not knowing what was wrong. And then in so many other cases, finding out what's wrong and then not having the right treatment or the inability to do something about it. So I consider that year of my life, my husband's life, maybe a little more than a few years, a gift because I got to know and understand these issues, and a gift because I got to see that enduring love that parents have, regardless of what is going on and what's wrong with their little baby. Many of you have gone through much longer and harder journeys. My colleagues and I are focused on improving the development of and access to life-improving care and life-saving treatment to patients living with a rare disease or condition. We made tremendous strides, as you know, in newborn screenings, allowing families across the country to screen newborns so that those born with rare diseases can begin the most effective treatments. In Minnesota, we've worked hard to offer one of the most comprehensive screening programs for newborns, but we need to do more to ensure that families in every state are able to receive effective and affordable screenings for their newborns that can diagnose rare diseases and conditions right away. That's why I am dedicated to make sure every pregnant mom has access to early prenatal screenings and reliably detect rare conditions. That's why I lead the bipartisan legislation, the Expanded Genetic Screening Act, to modernize Medicaid coverage of evidence-based, non-invasive prenatal screening of pregnant women. This will make a huge difference in increasing the accuracy of test results and diagnosis, lowering costs, and improving care for parents and babies. Together, we will forge a world where every rare disease is diagnosed quickly and accurately. Senator Roger Wicker and I over in the Senate, that is our goal as the co-chairs of the Rare Disease Caucus. We're going to work together. If we can work across the aisle, that means patients and doctors and legislators, researchers, advocates. We can all work together because we have a common mission. That is to diagnose accurately and early, find cures, and yes, save lives. Thank you, everyone, for including me.